Without Filipino nurses, the U.S. healthcare in many cities would not exist.
You walk into any hospital in LA, you're gonna see nurses that are Filipino. It's just the fact.
Without Filipino nurses, the U.S. healthcare in many cities would not exist.
At the height of the pandemic, these nurses saved lives.
COVID was new to the world. I didn't know how deadly this virus was, and I don't think my mom knew either.
But couldn't save their own. A disproportionate number of Filipino nurses died during the pandemic. These nurses make up 4.5% of the nursing population, but account for 25% of COVID deaths.
A number of us are able to stay at home. We are able to shelter in place and work at home. But Filipino nurses who are working on the front lines in this country don't have that privilege. And so one of the things that we can do is learn about their presence, learn about their history and the historical contributions they have made to American healthcare.
In her film, Nurse Unseen, director Michelle Hasway spotlights the role of Filipino nurses in America and the rich history of these first responders.
So a lot of this project was me just really coming to terms with my Filipino identity, seeing how my personal family history was rooted in all this broader history.
For 48 years, in the late 1800s to 1946, the Philippines was an American colony. According to historian Catherine Siniza Choi, Americans implemented nursing schools throughout the islands in the 1900s to civilize its people. During World War II, American soldiers relied on the Philippines as a medical hub in Asia. And since then, a steady stream of Filipino nurses has made the journey to America's shores.
What would you say was the hardest part of putting this film together?
You know, I realized it was a much more emotional project than I had anticipated. We deal with a lot of difficult and challenging themes, such as the mental health of our healthcare workers and how a lot of them were experiencing burnout on the front lines.
In the film, Hasway shows the struggle some Filipino nurses still feel post-pandemic.
It's unthinkable that many colleagues did not make it.
I felt very helpless, and I don't even know if I'm going to make it.
Our healthcare workers, our Filipino healthcare workers, are still experiencing residual emotional impact from the pandemic. You know, it's not over for them.
One of the New York City nurses she spoke to for the documentary attempted suicide due to burnout.
He survived, but that's just an example of how tough the job was for some of these nurses.
In her film, Hasway gives a nod to medical professionals of the past, present, and future, saying it's more than a stereotype.
Growing up, I always took that for granted. I didn't understand why. I didn't understand that there was this incredibly nuanced history behind that stereotype. So for all of those people either considering being a nurse or being pressured into being a nurse, know that there's so much more than this stereotype, this generalization, that there's a rich and layered legacy to be proud of.
Kat Sandoval, Scripps News, Chicago.